My name is Holly
Mhm.
Farbo. I am a hygienist of 21 years. I started in private practice. I was a hygienist for about 18 years in private practice. And then I took a chance and came to Aspen Dental where I lived. And I fell in love with it. I loved everything that we did as far as how we saw our patients. And then a job came available on the academic team, which is basically talking to students and getting the word out there about Aspen. So I happily joined this, and it's so great to be able to talk to students and get that word out for Aspen. So that's where I'm at now in my career. So today I'm happy to have Melissa. She's on with us today. She is a hygienist in our Butler office. So Melissa, would you go ahead and introduce yourself? Tell us a little bit about you, how you got to Aspen.
Yeah, hi. Hi, guys. I'm Melissa. I've been a hygienist since, I graduated in 2014. I got to Aspen, honestly, I was just really sick of my one job. I was sick of the pettiness, and Aspen just kind of was there. And I applied, and best decision I ever made.
Yeah, and sometimes we have other even doctors that had said, well, it was kind of like it was there, and it ended up being again the best decision. So sometimes that's sometimes the best. So well, great.
Oh, yeah.
Well, we're happy to have you. So let me just really quick explain what a DSO is, because sometimes people are a little confused. They call it corporate dentistry. That word I don't necessarily like, only because it sounds a little cold to me. And we're anything but that. We're the exact opposite. So basically, what a DSO is, we are a dental support organization. So for Melissa, you work for the doctor in our offices. Our offices are independently owned by doctors. So Melissa works for Aspen Dental in the office for that doctor. I work for ADMI, which is Aspen Dental Management Incorporation or Incorporated. We're on the management side. So my job, we do the recruiting, we do marketing, we do payroll and all of those things so that the doctor and the hygienists and the practitioners don't have to worry about that, and they can focus on patient care. So I always liken it to, if a dentist gets out of dental school and he or she wants to open their own practice, there's lots of things that they don't teach in dental school about owning a practice. Where do they find their patients? How are they going to set up their computer? Where is the best location for them? And getting patients in and hiring people, doing all the payroll, doing all of that background stuff that they don't necessarily
Mhm.
teach in school. We do that in ADMI. So we worry about setting up the offices. They're all from the ground up, brand new offices. We don't acquire offices. We build them from the ground up, and the doctor buys into that office, and that is his or her office. And we get patients. We have a call center that we have all these patients come in and everything. So we are the largest branded DSO at Aspen. So all of our Aspen Dentals are called Aspen Dental, which we're very proud of. So that's basically a little bit about a DSO. So Melissa, let me go over. In our offices, we have a 1 and 2 hygiene model. So what are you at in your office?
We're one.
You're okay? So you are the only hygienist.
Yes,
So tell us a little bit about your day, and how your flow of your patients. How does your day go? Like a flow of the day.
sure. So we come in, we always do a morning huddle, about 15 minutes, and we go over the patients, and if there's anything pertinent, we go over it. I'll usually see my first patient at 8 a.m. And I give an hour. So see the patient, do everything clinically. Doctor comes in, does a check, off they go. And I probably see it's from 8 to noon, and then at 1 to 1:30 we get a lunch break, and then from 1:30 to 5 see more patients. So it's very smooth. It's a very easy transition. There's not a whole lot of complications. I mean, I know what they need, done. Doc is I just love my doctor, Dr. Lockery. He's very good at, getting done what he needs to get done, and it's just very smooth. So from 8 to 5, it's doesn't, I mean, obviously it's a job, but it's not It's not hard. Whereas other offices I've worked at, it's very complicated for no reason. So it's very smooth.
Good.
Easy hours for every patient.
Yeah, exactly. That's perfect. So real quick, and I know this is a little bit different for each office, and because they are independently owned, what type of office hours do you have? Do you guys do Saturdays? What's your office hours look like?
So it's Monday and Tuesday. It's from 8 a.m. to 5. Wednesdays, it is from 10 a.m. to 7. So Wednesdays is our late day. And then Thursday and Friday is 8 to 5. Or no, I'm sorry. Thursday is 8 to 5. Friday is 7 to about 1:30. And then we do one Saturday a month. So it's not bad, honestly. The hours they work really.
Right. And so real quick, a little background too is the model of Aspen is, access to care. So we do on most all of our offices have one day where we stay late and one Saturday a month. And that just lets that patient, and when we do a Friday, it's usually half day and usually starting a little earlier, just to, get that access to care there. So, yeah, so that's nice.
And
So,
it's nice for us too. Like Wednesdays, when it's a late day, you get Wednesday morning to do what you need to do, and then Friday afternoon if you need anything to do. It's nice. You still have some weekday to do what you need to do.
Right. So, work-life balance is really important to a lot of people. Do you feel like you have a good work-life balance there? I mean, are they flexible at your office, and how does that work?
Yeah, no, I agree 100%. Work-life balance definitely needs to be established, and they're very good. I have a 2-year-old and a 4-year-old. When they're sick, I mean, that's kind of, they work with me a lot. They're very good about being there for me when I need them.
Great. Real quick, let's go back to this, and you were saying hours. How you're full-time, correct?
Say again, I'm sorry.
You're full-time, correct?
Yeah.
Okay. And so your hours, are there ever a time where you have to clock out because you don't have a patient? Do you have to leave early because of a patient who doesn't show up? Do they ever do that to you, or how does that work?
No, never. I don't know if it's because of the end of the year, but I've actually been having a lot of no-shows, some cancellations. Well, COVID too is, a cause of that. But if I don't have a patient, they don't force me to clock out. I do recalls, chart auditing. I mean, there's always something to do, but they will never say you don't have a patient, clock out.
Right. So do you have quotas? A lot of people get this misconception that there's a certain amount of patients that you need to see or in a certain amount of time. Talk about that, and as far as, do you have quotas, and is there a certain time frame that you have to see your patients, or how does that work?
Right. I don't necessarily think it's quota, but I mean, we have a budget to, they set a goal for us every single month. And per day, there's like a goal for us to do hygiene wise. But no, it's not like a set strict, this is your quota for today, make this quota. It's, if you reach your goal, you reached your goal. If you made budget this month, awesome. It's not cutthroat dentistry.
Right.
Yeah.
So as far as the budget, real quick, and again, this is something that people are very concerned about. A lot of what they hear is that we work on commission. So can you just real quick, and you can keep it simple, you don't have to go into too much detail, but about the compensation and how that you're paid. Are you commission? Are you hourly? What kind of incentive?
Yeah, no, I am paid hourly. If I make, so yeah, I work hourly, I get my hourly wage. If I make budget for the month, without going into all the math, depending on how much more over budget I get or over budget I make, I get a percentage of that. That's pretty much the gist of it. If you make budget, great. If you get over budget, that's even better for you as a hygienist, because you'll get a little kickback from that. You'll get an incentive. So it's not commission per se. It's you know, the better. Every single patient needs something. So whether, if you give them a powered toothbrush or prescription rinse, it's just adding to your quota, or excuse me, your budget. And if you get over that, that's just extra for you.
Yeah. And, you know, I used to always say, like, people used to ask me, do I have to sell? Like, I don't want to have to sell. I don't want to have to sell. I mean, how do you feel about that? Do you feel like you're selling stuff to people?
No, not at all. Like at other offices I worked at private practices, that's kind of what it felt like, because at a private practice, you needed that patient and you needed their money. At Aspen, it's not. With my experiences, it's not that. It's, yes, everyone could use something. If you have no decay, if you have, you know, if you're looking great, you could probably still use a powered toothbrush if you're using a manual. So you offer it. If the patient says no, okay. But I don't feel like I have to sell a product to a patient for the office, for my doctor. It's not something that's, you know, pushed upon me. And I feel like I don't have to push it on my patients. If they're doing good home care with a manual toothbrush, then they are. I don't feel like I have to force anything on them.
For anybody that joined, go ahead and there is a little question and answer button at the bottom. If you have any questions that we aren't getting to, we did go over a few things. If there's anything that you want to know, you can just click on that question and answer box and type in your question and we'll get to that. So sometimes you'll see me looking back and forth, and that's because I'm looking at questions. I have 3 screens here. So, okay, so that's perfect. Now, real quick, and like I said, I think one of the best things about Aspen that I loved is that they do their new patient a little differently than the private practices that I was used to being in. So can you go over a new patient exam and how that looks?
Yeah, so in our office, the assistant will come get the new patient. The assistant will take the x-rays, do the hard tissue charting, like the fillings and whatnot. And then they'll usually come get me and say, we have a new patient, we need a perio charting. I'll hop in and I'll do my perio charting. I'll evaluate whether I feel like they need, you know, a gingivitis cleaning or a scaling and root planing. And then doc will come in and assess the actual teeth. But I think it's just it's a good business model, honestly, because the patient will know what they need. And then the next time you see them, you just do it. You get right in, and whether it's a gingivitis or scaling and root planing or whatever, you just clean their teeth. They don't need to see doc again. I think it's smarter. And I'm not going in there blind with a new patient and doing a cleaning. If they're not a or if they're not a prophy and they're, you know, scaling and root planing, it's just hard to gauge. You know, I just like it better. It makes more sense to me.
It does. And so, you know, some of the things that I heard is because we do our new patients differently. Can you explain how that's set up in your schedule, as far as your like existing patients and then your new patient schedule, and how you juggle that from seeing your existing patients to seeing a new patient and how that flow goes?
Yeah. So sometimes it's a little bit more complicated than others, but I have one column for my day, and that's my existing patients that I'll see. And then I'll have an overflow column with anything I need. But then there's a new patient overflow column. So basically, I'll see my patients. The assistant will pop in and say, hey, I need the perio charting. Usually by then, I'm like 45 minutes into my one patient, so I'm pretty much done. So for the next 15 minutes, I'll pop in with the new patient, and I'll reassess. So it's kind of like a ping pong effect down the day, but it flows really well. The assistants help you clean. The assistants help you chart. So it's not like you're perio charting by yourself, you know, because that would take forever, especially if they do have periodontal disease. But it's just a good flow. It's constant. It's definitely constant, but it makes the day go by faster.
It does. And, you know, I loved that monotony of a patient, prophy would really burn me out over my 21 years. I really liked the back and forth. and the way that it was like a break between patients. And again, like you said, it was nice because when you see your new patient like that ahead of time, when they're scheduled in your treatment, you already know what that patient needs. So you don't have anything blind. You know how much time you're going to need. Go ahead.
Yeah. Well, and plus the new patient knows what they need too, because you're taking that time when you perio chart, you're explaining to them at that time why they should get the deep clean or the scaling and root planing, why they should get the gingivitis. Like you have that time to explain to them why we're actually taking time to check this before we do a cleaning. Like, because it's not just, clean and get on your way. So like, because a lot of patients don't understand there's 3 different sets. So it's really nice for them too to understand, oh, I need something more than just a clean.
Right. And that's again, just to touch base on, I loved so much that we had time to explain to our patients with our new patients, seeing them that way and only coming in for that new patient exam and comprehensive exam. It was nice to be able to say to the patient, explain what their needs were so that they understood it. So when they did come back for their treatment, or if we did treatment that day, they already knew what they were doing, what we were doing, explaining it. And, it was kind of a nice thing. So when you do your treatment plan, how does that go with the doctor? Is there ever a time when, you have a male doctor where he disagrees with you? Do you guys discuss that? Do you have autonomy to do those treatment plans? How does that work?
I'm the boss. No, he backs me up. I'll say to him, listen, this patient has obvious perio. He has clinical radiographic calculus. I mean, he needs STM2. He needs periodontal therapy. Okay. He says, okay. I mean, he has my back with everything. Clinically, he understands I know what I'm doing, and he trusts my judgment. So he's amazing.
Yeah, and that's a nice rapport. I had that same rapport with my doctor, that he would come to me and say, Holly, what do you think? Or and it was really nice. It was kind of like, what? He's asking my opinion, because that, we're a team, and that's what I love about Aspen, is that we are a team, and that's the way that your doctor relationship should be always, is a team player. You're the gum specialist, we're the gum specialists, as far as that's what we're trained to do, and we get treated as providers, which I loved. So
yeah, because you are.
Absolutely, yeah, exactly. What kind of tools do we have in our offices for your patient exams, like the new patients? What do you use, like if a patient comes in and to show them that they have periodontal disease, or to show them their oral health?
Yeah, we have like little flip charts, which a lot of patients love, because I can talk to them till I'm blue in the face, but sometimes they just need that visual to actually see what I'm talking about. So we have a flip chart that shows like the probing depth and what, this number means, that number means. Another flip chart shows like the systemic link between periodontal disease and, systemic diseases and whatnot. So we have visuals like that. We have the blue folders. I mean, that's kind of has just a written explanation of why we recommend what we recommend, and they can take that home and then they can read that. If they have any questions, they can always call us. But we have the flip charts, the blue folders. That's about it. Oh yeah, we do have the iTero machine, which is very fancy. A lot of patients like how high tech it looks, how high tech it is. But it's just a scanner. We take a 3D picture, creates like a 3D picture of the mouth, and it's almost like an intraoral camera and a 3D model maker in one. So that's another nice visual for the patients to see their existing restorations, their broken tooth, anything, their periodontal disease, their calc buildup. It's nice.
Yeah, and I've had I used the iTero machine. It was first being rolled out when I was in the clinical aspect of Aspen, and people, they were just amazed by the technology and being able to see their mouth in 3D. It's a very powerful, even aside from the Invisalign, which we do, and do you do a lot of Invisalign cases in your office?
We do quite a bit, yeah. And I love that PIC code, PCIH code. Get that little incentive there.
Right.
But yeah, no, we do quite a few.
Good. And so the iTero machine, obviously, that's what it's used for also, but the dental health scan, do you guys do those on every single new patient?
Yeah, the assistants.
Okay, so that's something the assistants do, but it's a nice visual tool, so that's always good.
Yep.
So what products do you usually recommend for your patients? How do you do that as far as like if a patient, what kind of products do you give them and what do you recommend?
Sure. So as far as the toothbrush goes, we recommend the Oral-B Genius, the new top of the line power toothbrush they have out. That's just a better clean. I mean, you can't really beat it. The circular toothbrush head just cups the teeth better and does a better overall clean. I recommend that for a toothbrush. As far as a rinse, I like chlorhexidine personally. I know there's some studies out there that say it's not a good product. I've always had success with chlorhexidine as far as scaling and root planings, just overall tissue health. I like the product. I'm going to keep using it. I recommend the chlorhexidine rinse. And then for a toothpaste, there's Floridex. It's like a sodium gel. It's just a higher concentration of fluoride, so it does a better job of preventing cavities and acid erosion from, the diet. So those are the three main things I recommend. MI paste, I recommend that a lot for patients that don't really like the fluoride. I do the MI paste, not the MI paste plus because that is the fluoride, but so I mean, I can honestly get whatever I wanted. If I wanted to switch from chlorhexidine to like a Floridex rinse, I could do that. I have the go-to to do whatever I feel is best.
Good. So since you brought that up, let's go over a little bit about the ordering. So how does that work as far as you ordering supplies? Do you have people telling you what to order? Do you have the autonomy to order what you want, or how does your ordering go?
Yeah, I can get what I want to get. There's like a monthly, not necessarily cap, but there's, they give you an allowance per month. But if you need to get more than that, they're not going to tell you no. So you get what you need. If I want this certain type of polish, I can order this certain type of polish. If I want, honestly, anything I want that I feel that I need for my patients for the office, I can get. You just click it, put it in your cart, done.
Yeah.
Very simple.
Yeah, and and I like that too. Again, and some people don't know this, but we use Henry Schein products. That's our supplier. We are the number 2 customer for them, right behind the United States government. So the prices that we get are the best. I hear people all the time say that we're expensive, and honestly, I can tell you from working in private practice for 18 years, we absolutely are not. You can compare our costs, absolutely. So do you guys do any kind of implants or anything in your office? How does that work with your implants or anything?
We do, but we have an oral surgeon come in and like once a month, and he'll place the implants. But as far as recommending, talking about them, we'll say, talk to Dr. Monty, who's our oral surgeon that we have come in, and they'll do a consultation, and he does the implants.
So who else do you refer out to? Do you refer out to any other, do you guys refer out? So you have an oral surgeon that comes in once a month, correct? And that oral surgeon, do they do sedation then?
They do, yep. Mm-hmm.
So wisdom teeth and anything like that, implants. How about anything else? Do we have any other specialty that come into your office?
I think they used to. They used to have an endodontist come in, but not right now, not currently.
Okay. And that's, I think, something that we're initiating. Some offices do, and because they are independently owned, there are different areas and offices that are different. So some do, some don't, just depending on the area. Or that's something I know that we're trying to initiate more is the endodontist, so that we have an oral surgeon and endodontist. How about for pedo? Do you guys see a lot of pedo? Do you refer out pedo? How does that go?
Yeah, I think we don't really see a lot of pediatrics. Like they asked me if I wanted to see a 6-year-old, and I love kids, so I said yes. But basically, we'll see. I think it's 8 and up. So if there was a pediatric patient, they're like at least 8 years old.
So can you give us an idea of your average patient? Like what's the average patient that we're seeing in our Aspen offices?
Probably like 40 to 50-year-olds. I mean, me personally, I know doc side, they see a lot of, because we do a lot of denture cases, so they see a lot of elderly. But I guess in that maybe 40 to 60 age range. But obviously I see adolescents too. I see much older. But I think that general area, like maybe the 40 to 60s.
Right. And sometimes I like to explain that to people because if they look at our model of our patient, you know, we're seeing your average age patient, like that middle-aged patient, you know, that's certain working class person that may not have time to come to the dentist, which is why we have our extended hours, you know, and we position our Aspen Dentals in places where it's easy access to care for people. So that's why you'll see, that's why we have so many locations, because we kind of cater to those patients who maybe, how about the patients? Are they patients that usually come to the dentist often, or do we see a lot of patients that haven't been to the dentist in a long time?
Yeah, no, we definitely get a lot of patients that have been 10, 20, 30 plus years that they've never seen the dentist, whether it's from a traumatic experience when they were younger, or, you know, just life happened and, you know, teeth get put on the back burner. So we see a bunch of patients that haven't been to the dentist in years. I mean, we do get the recare ones that, you know, are diligent, that come faithfully, but definitely we see a lot that have not been stepped foot into a dentist office for umpteen years.
Yeah. And, you know, that's why we see so many new patients, and it's a lot of times that way, you know, patients that have needs. And we call ourselves a yes company because we say yes to our patients. If you have a patient comes in, so say you have a patient that comes in that's in need because they have a toothache. How do we handle somebody like that? I mean, do we tell them they have to reschedule? How does that work?
No, so you'll go into the overflow as a new patient. We'll assess your needs. Obviously, we're going to take care of that, you know, toothache first and foremost, but then we'll also get an overall oral health assessment done on them. So they'll know, like, broad range. They'll know exactly what we would recommend in the future for them. But we definitely take care of, you know, their main issue first. We don't say, sorry, bad luck, Chuck, you can't see you. No, we always get them in.
Exactly. And that's what our yes, you know, you'll see that sometimes in our advertising, you know, is that we're a yes organization. And that's what that means. You know, we don't turn patients away. We say yes to them. If they want to start treatment that day, we say yes. So another thing, and sometimes what I do is I go through like lists in my head of what I see, you know, people either talk bad about Aspen or complain or whatever. And so if sometimes people know the backstory and kind of like what we're seeing on a regular basis at our offices, they kind of understand that a little bit better. So, you know, yeah, that's definitely one of them. The other thing is dentures. Do we do a lot of dentures? Do you guys do a lot of dentures in your office? And how does your denture patient, how does that work? That you would say is different than private practice?
Well, we have an on-site lab technician who can do denture repairs. You know, we can do impressions same day. Like it's very convenient for a person with dentures or a person who needs dentures. It's just very convenient to have that all in one facility, because it makes it so much. Again, it's just easier. We have that person there. If you need him, he's there for you. You know.
Right. And you know what I love too, again, I always, you know, I don't mean to interrupt you, but I give my little, but what I love about that is because, you know, being in dentistry for so long, what ends up happening is it's really hard for a lab tech that works 20 miles away from you, and they have a model of somebody's teeth and they're trying to make dentures on that. So it's so nice to have an in-house lab tech that the doctor that can just say, hey, mine was Jay. Hey, Jay, come over and look at this patient's face. Let's assess this patient as they're sitting in our chair and decide what this patient needs, what color teeth and what their desires are, and realistically what their mouth looks like compared to sending a little model out and saying, okay, make a set of
Yeah.
dentures for this person that you can't even see, you know.
Hmm. Well, actually, that
So,
happened today. Our technician walked in, and the patient's like, "You're doing such a good job, but I just want these lower or something like that." And he's like, "Okay, I know exactly what you want." And he did it, and it was 2 seconds, easy peasy.
yeah, exactly. I'm sorry, I'm just trying to
Hmm.
mute my chat here that I have. I apologize. I apologize if you hear me dinging. Technology, again, I try to be up on the tech stuff, but sometimes I forget. So I apologize. Hold on one second, guys. Let me just mute this because I'm going to get a million messages. Oh gosh, I am so sorry. Um, Here we go. We're doing, um, I can't see. I don't know why I can't mute this. I apologize. Busy. There we go. Um, Notification off. Okay, good. All right. Hopefully that works. Okay, perfect. So we talked about the lab. Give me a little oversight about COVID. I mean, obviously COVID is, hit, and that's been a big issue. I am involved in a lot of online forums for dental hygiene, and I see that people are struggling. How have you felt during COVID? Have you felt safe? Do you feel like you have enough PPE? And how has the appointment changed? Like, what do you do differently for your now?
So before, I never wore like a full gown. I was
Yeah.
just in scrubs. Before, I never wore a like a hair cap. I'm in a hair cap now, and I also never wore a shield before, which it's actually opened my eyes a lot because I mean, I feel safe working. I do, because we're donned, from head to toe. But I'm really glad, especially for that face shield. I was ignorant to what splashes back at me just through a regular cleaning,
Yeah.
So I don't think I'll, even if COVID, whenever it's normal again, I don't think I'm going to go back. I'm going to keep my face shield, my hairnet. But I feel very safe working. As far as like my appointments, like I get the hour. Not really a whole lot's changed as far as sterilization, because we're doing everything we should have been doing pre-COVID anyway. I mean, spray white spray. Yeah, no, I don't feel worried about going to work at all. PPE is great. We have what we need. Yeah.
And that's nice too, is we're finding, and this is just in Aspen, this is everywhere, that dental, it's not really being, passed through the dental part. So I know at the beginning we shut down, with COVID.
Mm-hmm.
Now I feel like they're, considering us essential, which is nice because, you can't let infection go by. So
Right.
let's go back to when you first started and what we do as far as any kind of training when you first come in the office. How does that work? How does that training work for you?
So I know mine was a little different because of COVID, but they took me to my home office, and they had a hygienist who had been working with Aspen for years. They had a hygienist come in and show me the ropes, show me the computer system, because it's just Aspen. It's original to Aspen, so it wasn't like a Dentrix or an EagleSoft. So she showed me how to use the computer, the policies they have, the certain steps that we do. And it was just very nice to have someone to bounce questions off of. You're not thrown into the deep end. Someone's there to help you. And she was there, it's usually about 2 weeks, but she was there for me for 3 weeks, just an extra week to just make sure I was okay. And I never felt, like I was drowning, like I couldn't get this. It was nice. It was really nice.
Right. And that's a nice thing about like new students, because I work with students a lot, and their biggest fear is having to go into an office and just be thrown into patients. And even for me, who was 18 years of experience in hygiene, you know, we did things so differently. I felt like, for a lot of years I was under treating patients, which I think is 1,000 times worse than anything else, is to under treat your
Oh,
patients, you know,
mm-hmm.
see that
Yeah.
coming in. So under treating patients for years. So I kind of had to get myself up on the new guidelines with the AAP. Did you go to a course for that? Do we use the new AAP guidelines for staging and grading perio?
I didn't I didn't do a training on that, but yeah, I don't, yeah, I didn't do that. I just
That's
treat
okay.
them yeah, no, I just do what, basically, I look radiographically at their x-rays to see if radiographically they have bone loss. I do the probing, and then I just mix those two, and I make my judgment call.
No, and that's the best part because clinically wise, you could take 10 doctors, you could take 10 hygienists. Everybody may have a little bit of a different opinion. So
Yeah.
it's that autonomy to be able to say, sometimes you have to actually look at the patient and not just the charting. Is that patient going to be compliant? Is that patient, there's a lot that goes into assessing a patient and what they need.
Hmm.
And so the nice thing is that Aspen allows you to do that as a clinician because that's what you're trained to do.
Yeah, exactly. And I know that can be kind of daunting for new hygienists, but it's, no matter what you do, you're helping the patient. Even if, you feel like you diagnosed something wrong, you're still going to be cleaning the patient. You can always reassess later, tell the patient what you find later. So it's not like you'll get that confidence.
Yeah, and that's just something that takes exactly. That's something that takes with time. The other thing, and I know you and I talked about this that you didn't get to go to pre-COVID, and hopefully we'll come back soon. I know it's called HOP, and it's the hygiene onboarding or hygiene orientation program, and that is usually a program that we send once you're enroll as a hygienist for a few months. We send you
Mhm.
to either Chicago, it used to be Syracuse and now it's Chicago because we have a training center in Chicago for 3 days, and you get to meet hygienists from Aspen Dentals around the country, and you get to meet the vice president Maureen Howell and Jan LeBeau. That she's our those are our vice presidents of hygiene, and there's all kinds of training, and basically what they're training you on is just why we do what we do. Basic why we do our patient exam this way, and with real facts. You get CE, you get to talk to the Oral B rep, and any products that we use, MI paste, all that, they bring in these reps to tell you the science behind why we recommend this stuff to our patients. And so that really you come out feeling good about your treatment plans for your patients. And I think that sometimes Aspen gets a bad name. It's, oh, they tried to make me buy a toothbrush and they tried to give me this and give me that. But for
Yeah.
me, it's stuff that I always recommended to my patients before, but now I actually had the science behind it and I had the products on hand.
Yeah. Yes. That's a big thing too. Actually having the products for the patient to just take, another convenience factor.
Yeah.
Because they're not going to go.
No, yeah. How many times have you recommended to a patient and when they came back in 6 months and you said, did you get that product? How many times did they tell you yes? Oh, I couldn't find it. That was the number one. They used to say to me, oh, I couldn't find it. Did you go to the pharmacy? Did you go to the toothpaste aisle?
You could give them the aisle number.
Yeah. Like, I'll look it up on Walmart and you can actually, it's right there. And they never did. But if you have a vendor and you say to them, this is something I'm recommending, can we give this to you today? So you can start using this. They say yes. I don't see why people see that as a bad thing. I think that's an amazing part of Aspen that we have those products and can give them at a really good price. So, I never understood that. So the other thing that again that I just a lot of times go off of what questions I've either gotten in advance or questions that I've gotten throughout my years with talking to hygiene students and stuff. What sometimes they get a little bit weird about having a management team or having a support team. Oh, is this somebody who's just going to yell at you? Can you give us a little? So you have a territory hygiene manager, and that person who I know is Lisa because she was mine too. She travels to different offices and she's there for support. Another thing that I love about Aspen is how much support they give their hygienist. Can you give me a little bit of an idea of what she does for you and what, and, you know, in her role and how she supports you and, you know.
Yeah, she's very active in your hygiene. So she's there for you if you have questions. I mean, we're a part of this text message thread. So if anyone has any questions, we can always go to there and talk to each other, talk to Lisa. She'll come by the office and she'll help perio chart with me. She'll say, oh, hey, you know, look in Doc's overflow, see if there's any oral cancer screenings you can do. She's, like you said, a support to help me just better my, I guess, business, you could say, better my hygiene role. It's very nice to have someone looking out, especially with the one hygiene with just me in the office. It's nice to have someone looking out for you to say, oh, hey, check this out, see if that can be done today. It's just nice to have a second set of eyes looking with me.
Yeah, and you know,
very
nice. Right. We do have a 2 hygiene model, and some offices do that, and that's usually a senior hygienist who is a lead and an associate hygienist who may either be, you know, not wanting the lead role or maybe part-time or just maybe a new student come in. And so the lead hygienist will kind of do the new patients, and they do it that way. Melissa's in an only hygienist office. That's what I was in. So you're pretty much doing all of that yourself, which is fine because you juggle that. And so what is the biggest difference that you find between private practice and Aspen?
Oh, feeling appreciated. The biggest difference is just feeling like what I'm doing actually matters to my boss versus me not producing enough because a patient won't accept treatment, because, you know, the private practice won't accept their insurance, but that's my fault. You know, like, just being appreciated, you know, it's not, he just appreciates what I do there and that I'm there for him, you know. Yeah, I'm not a number to him, and it's nice.
It is nice. Is there anything, and I'll put you on the spot here, is there anything that you don't like about Aspen? I mean, like I said, this is Ask Me Anything, so we don't hold anything back. If there's, you know, we know we're not always perfect, but, and that's something, again, with the support that we love to hear feedback from our hygienists. If something's not working, we try to fix that. So is there anything that you don't like or something that you feel like, you know?
Me being me, I'm a perfectionist, so I feel like it's, you know, they always say, hey guys, I taro scan every single prophy, every single perio maintenance, get that iTero scan going. And if I don't, it's like, and then they send back your number. Hey, you're at like -2% for scans. But it was one of those ping pong days that I'm like, I have no time. Certain things like that. But even that, you know, I'll get it the next day. It's not, again, just, there's not a whole lot about Aspen I don't like, because I've come from private practice offices that were just horrible. And Aspen is not like any of the offices I've ever worked at. I've only ever done private practice. And Aspen is it's just better. Sometimes you get aggravated with, it just, you know, sometimes you don't get that half-hour lunch because there's so many patients to see. You're doing so much. But to say that I don't really like anything, no.
Well, and you know, the thing is, I worked at lots of offices in private practice that I didn't get a lunch sometimes. I mean, unfortunately, that's the nature of the beast with hygiene, is that, you know, because you are in patient care and because you do have a schedule, that doesn't always fall the way you want. Something gets behind, the patient's a talker, you know, somebody's a gagger. I mean, that's always going to be something, again, you know, so that's nothing. Yeah, I mean, I think that the value. Yeah, I'm sorry, I didn't hear you.
Oh, I said that's just belly of the beast. That's what happens.
Yeah, you know, so, well, that's great. Okay, so talk a little bit about the metrics. And I know, again, this scares some people. It's like, oh, you have quotas, you have goals, you have all this stuff. I personally love the metric system. For me, it was never a scary, yeah, it was never a scary thing. It was like to see, I judged my own, what I was doing. Am I doing what's right for the patient? Am I offering those oral cancer screenings that every single person needs, or am I slacking on that? That was just
Yeah.
my kind of little guide. Was I doing right for the patient? So can you just explain the metric system a little bit, and a little bit behind why we do that?
Yeah, no, that's honestly, that's pretty much same for me. It's just I like checking my P's and Q's. I like looking to see where I'm at and how I could improve. Honestly, it's really super simple. It's on the home page. You hit the metrics button. It shows you all of your just where you're at for the month, for the day, like yesterday's patients, what you did, if you applied any type of arrestin, or if you gave any type of product. It just shows you where you're at in hygiene. It's not daunting. I mean, you might see a little red here and there, but it's not like it's a bad thing. You just can see areas where you can improve.
And I never felt like that was focused on. Like when I was in office, I never felt like my territory hygiene manager focused on that kind of stuff, because you always have something that comes up. It's more of a guide, and it's basically kind of a way to track and see what types of patients you're seeing. Are you seeing a lot of perio? Are you seeing, like in State College, for example, State College, Pennsylvania, that's a college town. You're going to see a lot more people that are prophies compared to, an area maybe where you're at, Butler, and where I was in Indiana, that sees more, perio patients. And like we all know,
Right.
perio now, half of Americans have some sort of periodontal disease, and it's been undertreated for years. And I think that's why we get a lot of.
It's got to be more than that, more than half.
At least in our area, right?
Yeah.
So how do you handle negative things that are said? Like if somebody says to you, "Oh my gosh, you work for Aspen," like how do you handle that?
Yeah, I do. I work for Aspen. I usually say, I'm doing exactly what I'm doing. I'm doing at Aspen exactly what I was doing in private practice, only better, more efficient. I feel like I'm doing my patient a greater service versus, well, we need this patient to come back. Don't upset them. You know what I'm saying? I feel like at Aspen, I can tell them, listen, you have this issue. This is what I recommend. And if the patient doesn't agree with it, I will not see them. If you have periodontal disease, I'm not going to give you a prophy. Whereas private practice, that might not be the issue. But I tell people Aspen is just better quality care. You're not a number. You're getting the care you need. And we're telling you, we're being upfront with you. We're not shoving it under the rug so that you'll stay at the office. We're making sure you get what you need done.
Exactly.
So I'm negativity. It's sad because that's all you hear is negative. It's a corporation. They just want you to buy this or that. But I say, well, no, I'm doing exactly what I would do in private practice, just better and more efficient.
Right. You're right. And unfortunately, like I said, for years, people have been undertreated, and so stuff has been pushed under the rug more. And at least there's lots of good private practices out there. I know that. I do know that people have good experiences. So you can't judge everybody. But I do know that in my career of 18 years, I undertreated a lot of patients, and it was because you didn't want to push that patient out the door by telling them everything they need. So can you explain just real quick? And we say, oh, and again, another thing I hear was, oh, I went into this office and they give me this big $5,000 treatment plan. Well, can you explain to people why that's happening? What do we do differently as far as our comprehensive exam? What is that?
Everything. You get an overall health assessment. You might be coming in for a toothache, and we'll make sure we address that. But we also do an overall health assessment, tell you why you need what you need done, so that in the future you can have health stability versus just drill and fill. Oh yeah, that tooth's hurting you, let's pop it out and we won't see you again. until your next toothache. We'll see you again for your cleaning and your recare, and heaven forbid something else comes, we catch it sooner rather than later. So yeah, you might have a $5,000 treatment plan, but that's the long-term goal. We want you at a state of health, so this is how you're going to achieve it. It's not, but yeah, we always say, we'll take care of your boo-boo tooth first, but really you need some other stuff too.
Yeah, exactly. And we don't sugarcoat it for people. It's basically, we tell you what you have. And, we have documentation, and again, that the dental health scans. I mean, you can look at those dental health scans as a clinician and be able to tell if we're calling perio for a patient, it's because they have perio. We perio chart every patient. Do you know how many patients I had that were like, oh, they poked me with that pokey thing that's called a perio chart, and that's something that's standard of care that you have never in your life gotten from anybody that you went to. That is a disservice.
I come at them and they're like, what is that? What are you doing? I'm like, oh, this is something that should have been done at your old office. Yeah, they don't know what it is.
It's shocking to me how many people didn't know what a perio chart was as far as the process of it, which means to me, they never in their years of going to a dentist had one done.
Yeah.
I mean,
how are they assisting you?
how are
literally
they
just
yeah. I had a patient once tell me they had perio and it was bad, and they went back to their old office and said, why did you never tell me this? And the dentist said, because I didn't want to scare you. And that was the answer that they got. So again, you have to look at sometimes, some of the complaints that we have is because the patient isn't used to the standard of care. They haven't gotten the standard of care. They haven't been treated the way that they should be treated. By telling that patient, listen, you're an adult, we're going to tell you everything. Doesn't mean you have to do everything today, but we're going to let you know everything that's going on in your mouth. That way we can make up and set up. So how do you do with financials? Do you talk to your patient about the finance part of it, or how does that go?
Nope. So I just clinically tell them what they need done, and then they'll talk to the office manager, the assistant office manager, and they'll have the breakdown of the finances. And they'll talk to them about, financial options for them, whether it's financing or, payment plans or whatever. But I don't talk money. I'm not too good at that.
No, and that's great. You don't need to. I mean, you are there to, assess that patient and tell that patient what they need. And, the financial part of it is honestly up to the PSR, the patient, the treatment plan coordinator we have, or our office manager, and then they can work out the details. I mean, we like to give our patients options as far as treatment. So, we have goals. And again, another thing I always heard is, oh, they try to push you into financing. It's not pushing you into financing. It's making that treatment available to you. And if unfortunately that has to be because, your insurance doesn't cover everything, or you don't have insurance and you're self-pay, we don't want to just say, okay, then goodbye, we don't want to do treatment. No, I mean, you still have needs. So we're going to give you options of how we can get those needs to you, which is nice. So real quick, this is one other thing, and then we're going to kind of wrap it up because we talked for an hour. Look at this. Didn't time go flying by when you're talking about something you love? One other thing that students are real big on is giving back to the community. So can you give us a little what we do to give back to the community at Aspen? Do you do the well, you know what, so I put you on the spot, and I apologize. No, and it's because you're fairly new to Aspen. Did you guys do a day of service? Did you talk about day of service?
No.
Okay.
Probably not. Probably because I started after COVID.
Yes, and you know what? I'll tell you this real quick, because day of service is probably something that you haven't done yet, and that basically is a Veterans Day every June, which you haven't been there June, or you missed it because of COVID. Generally in June, we do a day of service for veterans, and it's where we give back to veterans. And that's something that we do every year, and that's, veterans come in, we give them free care, and then we choose a veteran to finish their care. The other thing is our mobile mouth unit, which is something that, again, COVID has put a knot in a lot of these, little kink, but that's something that we go around the country. We have our own staff that goes around the country and treats veterans for free. And a lot of that is on our website that you can look at. And of course, you can always reach out to me. I can send you this video. If you have any questions, I'll give you my email address. So you can always do that.
Yeah, and we always do veterans like a 25% discount, I think it is too. When they come in, they get the discount every day.
Okay, so one last question, and again, this goes back to being a yes organization. What does that mean to you? How has that impacted you? Do you have a good yes story with a patient that you can share with us?
I do. I had a woman. She had severe perio. She was there. She was crying in the chair. She felt gross. She's like, I can't believe I let my mouth get this way. I can't believe this is the state I'm in. And I reassured her. I'm like, it's okay. Even though this is what it is now, let's take care of you. And we'll go from there. So she came in, we did periodontal therapy. We cleaned her mouth up. The next time I saw her, in the 6 to 8 week period to reassess, she came in and she was crying again. And I'm like, oh no, oh no, what's going on? But she was happy. She's like, food tastes better. I can smell better. My teeth and my gums don't hurt. She said, this is the best decision I've ever done. Thank you so much. She's just very grateful. She was crying happy tears. So it was very satisfying to get that gratitude back, because I do love what I do, and it's very nice, to see the befores and afters, but to feel that gratitude of like, oh, I made her happy. it was really nice.
That's a good story. That kind of stuff always makes you feel good. So we have come to our end here, and I just wanted to say, thank you so much for joining me. I'm so glad that you are part of the Aspen team. And I really appreciate your time, Melissa. So is there anything else that you want to say before we leave?
Nope.
All right. Well, great. You enjoy your weekend, and thank you again for coming on here and answering my questions.
Sure.
All right. Have a good day.
Thanks. You too.
Okay. Bye-bye.
Bye-bye.